So the figures are through this morning on the COVID numbers in Victoria. They're not great, they're not terrible, but they are annoyingly persistent. Over the last week or so with this outbreak in Victoria, we've had kind of day after day of not really high numbers, but they haven't been going away. Reporter Steph Ferrier joins us now from Melbourne with this lockdown, this initial period of the lockdown due to end tomorrow night. So Steph, take us through these latest figures.
Yes, good morning, Joe. So as you say, there are 6 new cases of coronavirus recorded. So that brings this cluster now to 60. That is off the back of another really big day of testing numbers, 51,033 test results that were received. Now, we also had a really bumper day for vaccinations as well in the state's vaccination hub, which was more than 20,000 vaccinations. Just in terms of these 6 new cases, we have recently heard from Professor Brendan Murphy, that's the Federal Health Secretary, and he says that we now know that these 6 cases aren't involved in any sort of aged care, so there are no residents or aged care staff among those. He's also told the Senate's Estimates Committee that one of those cases is believed to be this person who travelled up into southern New South Wales and then came back, and most of the other cases are some of his family members or close contacts. So there's a little bit of a picture of who we're dealing with there. But obviously these numbers, well, they're still persistent, as you say. So that is probably not the best in terms of looking at whether or not we're going to get out of this lockdown. Yeah, and so tell us about that lockdown. Obviously people in Victoria, Steph, are very, very well aware of the details of that. But for people outside Victoria, tell us when the lockdown started, when it's due to finish, and what are the considerations being taken into account as to whether it's going to be extended or not. Sure, yeah. So the lockdown started last Friday. So we're in the second last day of this 7-day lockdown that was due to end at 11:59 p.m. On Thursday night, but we now know that senior government ministers and top health officials also were locked in talks last night, just dealing with options on how to extend this lockdown. Unfortunately, they are deeply worried about this rampant spread of the Indian variant and how contagious it is, because it appears as if it can infect people just through fleeting contact alone. In fact, last night we heard from Professor Brett Sutton. He is our state's chief health officer, and he says that this virus can move very fast now, and so much so they are now going to have to look back on their more than 300 exposure sites in new light and re-examine them in terms of the contagious nature of this virus. He also says that this is the biggest challenge that we've faced so far in Australia in a very largely unvaccinated population. And he has further said that should we allow this virus or this strain to circulate unchecked, as it has in many other countries, then many people will die. So you'll have to say that the language we're hearing from the officials is certainly strengthening, which tends to indicate that there will be an announcement to extend this lockdown. We don't know yet exactly when, because we still have no information about the timing of a news conference today. One would have thought that they might announce it today to allow some of those hospitality sector, for example, to be able to cancel any orders ahead of the weekend in terms of food and other necessary supplies for going forward.
Continues to be a day-by-day, case-by-case proposition. We are finely balanced. This is a significant and very concerning outbreak.
That was just so you know, the Health Minister, Martin Foley, when he was asked repeatedly yesterday about whether or not we were going to have an extension of a lockdown. He said that he simply didn't know at that stage, because they could only rely on the latest case numbers and the latest piece of evidence, because this virus was so unpredictable. But you'd have to say that with the numbers of exposure sites going up to now 351 and these 6 new cases, well, it's likely that we're probably going to go into an extension.
And Steph, what's the latest on those warning areas?
Yeah, so just in terms of the warnings that we now have is that there's a real concern about this fleeting nature of contacts being able to transmit. We heard from Jerome Weimar, who is the state's testing and COVID response commander at the Department of Health yesterday as well. He was saying that it's a real concern because we are seeing that it's particularly 4 or so different cases where people have picked it up through very fleeting contact. In fact, one of the 3 cases from yesterday was a man who lived around the corner from Stratton Financial Hub where they've had a couple of people infected there. He had never even visited any of these exposure sites but somehow managed to pick up the virus. So now they're asking people to go through all of these popular, anybody that's visited any of these popular sites, these shopping strips around Melbourne. There's about 10 of them that Jerome Weimar specifically pointed out. Even if you are feeling fine, you don't have any symptoms, this doesn't get limited to a particular date or a particular time in terms of an exposure site. Anybody who's been there in the last 1 or 2 weeks should go and get tested because they want to leave no stone unturned. This is what he had to say.
This is stranger to stranger transmission. What we're seeing now clearly is people who are, they're brushing past each other in a small shop. They're going around a display home. They're looking at phones in a Telstra shop. This is relatively fleeting contact. They don't know each other's names, and that's very different from where we've been before.
Now, one of the cases that was listed as a fleeting contact was a woman who had visited a display home out in Mickleham in Melbourne's north. The ABC has spoken to her family and it now appears as if she has since returned a negative test. So she originally tested positive, but there has been a subsequent negative test involved in that. And her family says that they were surprised with that positive test given the fact that she had visited that home 2 days after an infected person had gone there.
Okay, we'll leave there. Steph Ferrier in Melbourne.